fertility fact. What does it want? It always asks for a topic. Fitness. Okay, this is a fitness channel.
It's a fitness channel.
And you're live.
Channel.
It's the best I can do.
Hello, everybody. Welcome to another absurdly wild episode of Fertility Fact or Fiction. I am your host, Dr. Rai Victory. I am a fertility specialist, double board certified in reproductive endocrinology and infertility in both Canada and the US. And my sidekick, who gives me endless joy because I laugh my head off at him, is Tarek Ibrahim from Ibrahim Strategies Group, who is my faithful companion and sidekick and all things amazingly web. So does this mean you don't need my phone?
Yeah, just give me your
Give you my phone?
yeah, just for Instagram.
Yeah. Oh, for Instagram. Okay, well that I got a program for you. So here you go.
It must.
Oh, I guess I should nix that. I gotta find me. So tonight's show, we have nothing exciting to tell you about. There are no great studies out to review. There is no new information about anything tremendous. I haven't found a single amazing study. I did, interestingly, have to delve into a little bit of an argument with a physician who posted today on Instagram that high progesterone levels are not detrimental to fertility, but that actually isn't true. High progesterone levels are detrimental to fertility cycles. And so I posted one article, and then after I posted that, a bunch of other ones came up, also showing the same thing, including one from Shady Grove Fertility, where they also demonstrated that high progesterone levels are detrimental to fertility cycles. Now, if you're trying on your own, we don't even measure progesterone levels. So I think the point that physician was trying to make was that in a natural cycle, it doesn't really matter what your progesterone levels are. And I have to say, I completely agree. Because if you're trying naturally on your own, you don't even need to monitor your progesterone levels the vast majority of the time, unless you have some kind of progesterone problem. But for people that are doing fertility therapy, especially IVF, your progesterone levels are important. Too low, it doesn't work. Too high, it doesn't work. Are there exceptions? Yes, of course. Every patient's care must be individualized, and that's critical. But at the same time, we want to make sure that we're not overdoing it or underdoing it. The one major group where higher progesterone levels are not only not bad, but important, kind of critical, are the patients with endo and adeno, where there's progesterone resistance. You look very worried.
I think there's no audio on TikTok.
Oh, again?
Audio on TikTok.
Is that what people are saying?
That's what I got so far.
Oh no.
I'm working on it. Audio. There's always something.
There's always something. Should we just go on my phone?
Keep talking. Let's see.
I'll keep talking. So anyways, tonight we're going to take your questions again. We've had that for quite some time now. It's helpful for getting through some of the gajillions of questions people ask us. And at the same time, there's really no good articles to share with you guys. I usually scour Human Reproduction, which is the big European journal for fertility, Fertility and Sterility, which is the big American one. Human Reproduction Update, where they do meta-analyses. I look at Reproductive Biomedicine Online, which is the Canadian one, essentially, or at least we have a subscription to it through the Canadian Fertility and Andrology Society. And then I also look at Journal of Reproductive Immunology, Journal of Assisted Reproduction and Genetics, Gynecologic Endocrinology. There's a couple of other ones, and then the big ones like New England Journal, Lancet, and so on. So there's nothing great out recently in the fertility world. No huge breakthroughs, no huge news here, other than that in about hopefully 6 months or so, we will start our own PGT program. So I'm excited about that.
Got it.
You have audio? You did it, man. Congratulations.
Just sweating.
Now you just got to remember it for next. Well, you and I are sweating because of our dinner.
Yeah.
Tarek and I had Indian food tonight, and were silly and didn't think of telling them not to put in as much spice. So we were both having a very painful dinner experience trying to wolf it all down. And then Dr. Pattinson came along and tasted some, and he seemed to have no problem
He seemed
whatsoever.
to have been handling it like a champ.
He was a champ. Yeah, I don't know what the deal was with that, but anyways. So you got questions? Anyways.
Yep,
So
I do. I just want to make sure. Okay, very good. Of course. We'll start here. Can adding fragment to a transfer cause an increase in neutrophils?
oh, I don't know the direct answer to that, but I do know that fragment is a relatively good anti-inflammatory. So in theory, it should decrease your neutrophils, but I'd have to look that one up. I don't know that I've ever actually specifically looked up the answer to that. I'm happy to check while you ask me the next question.
Yep, no problem.
I'll check that out.
Hi, Dr. V. Seeing you in February. Wondering how to improve athensospermia and poor morphology in the interim.
Asthenozoospermia,
Mm-hmm.
slow sperm.
Mm-hmm.
So watch our video on YouTube about how to improve sperm for sure. It's really simple. There's just 4 things you can do. So number 1, no smoking, no drinking, no drug use. So people always ask, what do you mean by no? Like, do you mean no? I mean, no, 0. Don't drink, don't smoke, don't use drugs. No gummies, no vaping, no chews, no, drinks, nothing, 0. Number 2, ejaculate every day or every 2 days. I actually talked to a couple today. You'll love this one. The fertility specialist told them that it was dangerous. This is in Toronto. The fertility specialist told them, I was actually laughing, that it was dangerous to have sex after the ovulation.
Dangerous.
Dangerous. I was like, what? Where do people get this stuff from?
I told you I could do this half the time.
You could probably do a better job. So anyways, have sex every day or every 2 days, nonstop the whole month. A couple of days off around the period. But aside from that, every day. And then number 3, take the fertility vitamins. They do make a difference in a lot of guys, especially if they're vitamin deficient. And then number 4, critical, make sure that you are keeping your testicles cold. Same guy that told them not to ejaculate, he told them cold was harmful to sperm production.
No way.
It's like,
really?
How do you get a degree with that? Like, I don't get
Amazing.
it. There has to be some sort of minimal requirement for passing.
I can create the
beyond
criteria.
Just beyond a pulse.
Yeah, beyond the pulse.
Yeah, I won't tell you who that doctor was, but big fertility clinic. So, anyways, yeah, it was kind of terrifying to hear some of that stuff. So, yeah, those are the 4 things. No bad habits, lots of ejaculation, lots of vitamins, keep your testicles cold. Clear and simple and easy.
Hi, Dr. VNT. Would you need extra progesterone for a 3-day FET for endo patients? Just like for a 5-day FET, you need 6 days of progesterone.
You need an extra progesterone level. So patients with endo or adeno have progesterone resistance. So they need more progesterone than patients without endo and adeno. So whether you're doing a 3-day transfer or day 5 transfer or day 6 transfer, you still need a higher level of progesterone. But you don't want to go an extra day longer. You just want a higher level. I hope that answers your question.
Can you explain a HLA-DQA partial match fertility results?
Oh boy.
How concerning is this result? And what are the treatment options?
Well, essentially you share a specific marker on your cells with your partner that is a problem, because when it's shared partially or completely, the immune system is not happy about that outcome and can be in more of an attack mode and not allow the implantation to occur the way it's supposed to. So in a partial setup or a full setup, if you talk to the guys at Fertility, they believe that the approach to this should be a combination of either subcutaneous IG therapy or IVIG therapy and lit therapy, where we sensitize you to your partner to reduce it. Dr. Zaneku, my good friend in Toronto, believes that that's probably less valuable when you're a full match because you're already a full match. So you're sensitizing someone to something they already have. So that may not work. And I have to say, logically, what he's saying makes complete sense. But then talking to the guys at Fertility, they still believe it's helpful because of all the other potential modifications and ways that the genes can express themselves slightly differently, different glycosylation patterns, different expressions, different splicing of genes, and so on. So hard to know whether these treatments work for sure or not, but the main ones are to use either lit therapy or sub-Q IG or IVIG. Dr. Zanaku also mentioned to me once that he's using heparin, so that's another option as well. And we do use that from time to time for those patients.
What supplements we should continue after FET, age 41, possibly endo?
Well, I would want to know if you did have endo because that makes a difference in the supplements. But the main ones we always recommend for every FET, your prenatal, continue doing your coenzyme Q10. Oh, sorry, for FET, prenatal, vitamin D, fish oils, iron usually, but get your iron levels checked, and melatonin. Those are the ones that you want to use for any FET. We also use aspirin. I don't consider that a supplement, but it's crystal clear that in older women that should be mandatory. There are new guidelines out, which I probably will review with you guys for our next show, from the Society for Maternal Fetal Medicine on how to manage IVF pregnancies in women. And they were interesting, a little eye-opening. This is stuff that is not standardized anywhere else, including how many ultrasounds to get in the pregnancy and what to do near term and when to deliver and how to treat those patients and aspirin and so on. So maybe that would be a good one to share with everybody next time. Yeah.
I suffer from severe ovulation pain. Is that normal? Plus, I have no right to because of ectopic.
Well, if you're suffering from severe ovulation pain, that can be from a variety of different reasons. There are some women that get what's called Mittelschmerz, which is just pain in the middle of your cycle, ovulatory pain, and we don't always have a reason. There are women that get it because they have bad endo or infections, or you are dealing with an ovary that is adhesed, meaning stuck to the sidewall or encased in adhesion. And sometimes you're ovulating into a really uncomfortable space, and the fluid from the follicle builds up and causes a lot of pressure and pain. So make sure you see either a gynecologist or an RE, and make sure it's someone that cares about looking at the source of the pain and not just trying to get you pregnant, because it may require surgery. And I find more and more REs just poo-poo everyone that needs surgery and say you don't need surgery, but you actually do need surgery. Okay, wait, hang on. I'm looking up heparin. I typed in heparin and neutrophils. And there's nothing. Okay, let's get rid of systematic review because I had a filter. It just, wow, there's a lot here. It just basically says that heparin likely reduces your neutrophils. Yeah. So I was right. Yeah, there you go.
Can a SCH not always show on a ultrasound? Is it showed there was some fluid in cervix?
An SCH frequently will not show up on an ultrasound. It actually has to be relatively large to show up on an ultrasound. So small SCH will not show. Larger SCH is subchorionic hemorrhage. For those of you that don't know what SCH means, will show up, but smaller ones will not. So it's quite common not to see it and still have bleeding in the pregnancy.
Do you allow donor embryos from the US?
Oh yeah, absolutely, no problem.
I'm on the list since August for a laparoscopic surgery. How long you think the waiting time? Plus, I have low AMH levels. I'm really depressed now.
Well, I'm sorry you're depressed. We have a huge program for the psychological support of our patients. Right before this show, we were about to do a video on psychological well-being and support. but it got nixed. So because we were trying to prepare for TikTok. Um, so there are lots of supports available for you. I don't want you depressed for sure. With regards to the surgery, we're catching up very well. And then those lunatics hacked the entire region's hospital system. So 5 different communities had their hospitals, or I should say 5 different hospitals and 4 different communities were hacked, and they basically shut down the hospital system. So that set us back a lot. Now, thankfully, it is back up and running as of tomorrow. So we should be back to normal after that, and everything after that should be okay. So hopefully we'll catch up with you soon. If your AMH is drifting down and it's urgent, please contact the office and let them know, and then they'll bring it to my attention. And if we can prioritize it ahead of other cases, we will. I don't want to give you any guarantees because I can't make any, but if it merits prioritization, we will obviously prioritize. Clearly the most pressing cases are women with cancer, and then women who have debilitating pain, and then people with, severe anemias and so on. So we have people with major issues that need to be dealt with first. That's not to discount the suffering of women with infertility. I'm fully aware of that, but it's a matter of how much OR time we get. Believe me, if I could live in the OR day in, day out, and just do consults for this and get technicians to do the technical part, I would be thrilled to do that. I love being in the OR, but it's not possible. We just don't have very much OR time. I am in there tomorrow. So
Does cycling affect male fertility?
huge. There's actually good studies demonstrating that cycling is very bad for sperm performance because there's pressure against the testicles. Sorry for that weird gesture, but
Hey, I didn't say a word. I just let you do it.
so yeah, any kind of pressure, heat, compression against the testes is not good. So the biking shorts are super tight, as we all know, and then you're sitting on that tiny stiff little seat, and then you're kind of crushing the testicles by pedaling all the time. None of that's good. Like that whole scenario, I'm clenching just thinking about it.
Never riding a bike again.
Never. Yeah, so
From now on, I'm driving. That's it.
no more biking. So yeah, it's not good for you. It's clear. Interestingly, and I don't know how many people out there know this, but truck drivers, same deal. If you're a truck driver, you have poor sperm quality because you're sitting the whole time, pressure. Not all those truck drivers are in great shape because they're stopping to get coffee and donuts and whatnot at every Tim Hortons along the way in Canada. So yeah, truck drivers have bad sperm from compression, from heat, bad diets. And then the cyclists have terrible sperm. It's very, very common.
What about truck drivers with the cooling seats?
Oh, the cooling, I don't know. Does your car have cooling seats? Does it?
I
Yeah.
think I'm going to keep it on now.
Not
On
maybe,
in the winter,
maybe not
on
in the
the
middle
summer.
of winter, dude.
Precautionary.
Yeah, precautionary. I think Murph would kill you if you had any
If
more
I
children.
had a precautionary thought. Hi.
Hi.
Did Fertilisis microbiome panel had multiple infections? Do I
Okay.
need to wait for the retest before TTC,
Yeah.
or can I start trying after the antibiotics are finished? My husband had only Enterobacteria.
Enterobacter?
Enterobacteria.
ACA? Yeah. No, you should wait until you retest because if it doesn't clear, and frequently it doesn't, it takes quite a while to get that sorted out, and then you need retreatment. I had dinner with the folks from Fertilisis, and I spoke with Panagiotis, the main guy over at Fertilisis who founded it. And he actually told me that VRC has the highest rate of clearance of bad bacteria out of everyone in the world.
Really?
Yeah, we have the #1 rate. We're still not perfect, which shocked me actually, because I was like, God, we have a lot of patients where it doesn't clear. And I'm like, torturing people with antibiotics. But he said we have the highest rate of clearance. No one's even close. So it still doesn't clear though all the time. So I would be cautious in proceeding until you have confirmation that you are in the clear, because otherwise you're at risk for miscarriage, stillbirth, well, maybe not stillbirth, but miscarriage, preterm labor, premature rupture of membranes, all the things that bacteria can cause.
If you like the show, make sure you hit
If you like the show, Tarek wants you to know, make sure you hit the like button and subscribe. Push that subscribe button. You need to get, you know how on the other shows people have the subscribe button?
Live shows are very different.
Yeah, you got to do
Live shows.
it.
I can't even move my screen right now. There's just so much going. How long do you typically have patients wait for a transfer after an endo lap?
It depends. If we're suppressing them until their suppression is done, which is 3 months. If we are not suppressing them right away, the sooner the better. Did you try the tea?
Yeah.
Was it good?
Eh.
So this is one of our viewers brought this for me as a gift.
Very
It's
thoughtful, very kind, very appreciative of it.
I haven't tried it yet. So it's honey.
But mine got cold quick.
Oh,
for what it's worth.
Sorry,
cold teas also.
I bought you your own Ember mug.
I should just leave it here.
You should leave it here.
I should leave it here.
I got honey, vanilla, chamomile, right?
Yeah, that's right.
I don't think I've ever had chamomile tea. Here goes, bottoms up.
Yeah, bottoms up.
Oh, I love that.
Maybe it's cold.
That's really smooth. That's
smooth.
good. That's really good tea. If I conk out on you in the middle of the show, it's because I'm falling asleep from the chamomile. I actually really like that.
I feel like I got a bad cup.
That's my mug. That's my other mug.
I don't know what the hell
this is. You got to bring. Should I buy you another one for Christmas?
No. I have mine.
I'll get you one for here. I'll label it because it has your name.
I know that. Yeah. I still put that in my house. And then I saw my wife walking around with us. I said, "Do you not know how to read? This is my mug. Why would you even take it from my desk?"
Yeah, never go to your wife with, "Do you not know how to read?"
There are days you start a fight. There are days you just. It's sentimental value. That's why.
It's sentimental.
Sentimental value.
Merv, Tarek still loves you.
Yeah.
And he knows you know how to read.
Continuing on.
Yeah.
Ever so quickly. Hi, Dr. V. My naturopath suggested I get tested for additional MTFHR mutations in addition to the one you sent me for.
Yeah.
Could having other MTFHR mutations impact my IVF cycle and or a miscarriage?
You know, there is an endless litany of MTHFR mutations, and there's arguments over which ones actually have an impact and which ones don't. If you're that concerned about it, just go on aspirin and heparin, because quite frankly, aspirin and heparin are relatively harmless and they're easy to use. And that's what we use for the MTHFR mutations anyways. So, you know, there is literally an endless number. I don't think it's practical to keep going back and forth checking, but if you want to check the other ones, you can. We just check for the ones that are part of the thrombophilia screen, but there are companies that go through like every single possible mutation.
You know, one of the patients that sent you the tea is online right now.
Oh, really?
Yeah.
That tea is awesome. Thank you. I love you. And I'm sorry I nearly made you pass out today. But the tea is amazing. It's really good.
I'm quite convinced it's because it's cold.
Yeah. I was
you made me have a heart attack before the show started.
I won't say what I was doing because that's probably a privacy breach, but I was assisting this lovely individual, truly lovely. She's a wonderful young lady. And she almost passed out in the process of what I was doing. So I felt bad about that. But I did rejuvenate her with some Lindor. So
she says forgiven.
Yeah, you can't go wrong with a Lindor. That'll buy you forgiveness.
That buys a lot, to be honest.
You're still in the doghouse with Merv for what you just said. You're going to need a lot of Lindors for that one. Like, you know, that 150 bucks
about her,
one in each hand.
The good thing is that since, you know, she doesn't watch the show regularly.
Yeah, it slides by.
I think it slides by. Yeah. I could get away with saying a lot of great stories on here.
Let's not go there, man. But if you choose to, I promise you I will give you a beautiful eulogy.
Yeah, I would appreciate it. I appreciate that. I have a very interesting question here.
Okay.
From TikTok.
Uh-huh.
I'm both unvaccinated.
Okay.
And uncircumcised.
Okay.
Can I become pregnant?
What?
Yeah. I just read them. I don't write them.
I don't. So if you're uncircumcised and you're referring to being male, you cannot get pregnant if you currently have a penis. That's just not possible, unfortunately, regardless of any gender identity. If you have a penis, it would naturally mean, with very, 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 very rare exceptions, that you don't have a uterus. And in lacking a uterus, you cannot get pregnant. So that would be impossible. Could you get somebody pregnant without being vaccinated and not being circumcised? Of course. We were all doing that for decades before we ever even heard of COVID. So
Not to
probably
worry, man.
probably a prank, but an interesting one.
I felt it was worth reading. Hi, Doc.
Hello,
Oh, hi, Dr. V. Auntie.
NT. Okay.
What's the success rate after LIT treatment, and how long would you need to wait after the second LIT treatment to retest and to try?
So you should wait a month after your second retreatment or second treatment to retest, and then you can try right after if the results are positive. With regards to success, the meta-analysis I included in our consent form to give people some scientific background says that there's a 45% increase in live birth. So the only reason we do it is because there is data that supports doing it. Otherwise, I wouldn't. But it's pretty clear that it does, provide some significant assistance.
Hi, Doc. Does it matter which side they insert the IUI catheter? I had more eggs on the right side, but they inserted on the left of my uterus. Both tubes are open. Does it matter?
What? So your uterus, unless it's an abnormal uterus, should only have one chamber. So you don't insert it in the tube, you insert it in the uterus. Now, there are people that actually do insert it in the tube. That's been shown to actually decrease success because it causes tubal spasm, which causes contractions, which just ejects all of the sperm anyway. So that's not a good idea under most circumstances. That Indian food nearly killed me. I've still got a runny nose from that.
I just want you to know my stomach has never felt more bizarre in my entire life. I have no idea what's going on in there. That's why I can't tell if it's the reintroduction rather of carbohydrates,
Carbs, yeah.
or it's just a non-stop amount of fire. But I feel something. I feel something.
Tarek has been off of carbs in a valiant, and I applaud him, valiant effort to lose some weight, and I have tried my best to stop it, but he has been very fastidious about his dieting, and so tonight was the first night, and it's been what, 2 months, 3 months
since the end of September, yeah. So September, October, November, yeah.
Yeah,
we're
two and a half months.
yeah.
Where he
I'm done at Christmas anytime. Anyway,
You're done.
that's it. Like I am gonna pig out. Whatever it takes.
And then just undo the last 2.5.
Yeah. I'm catching up. I am catching up, baby. Does progesterone help prevent premature rupture membranes? If not, what does? If this happened to me at 36 weeks last pregnancy, am I at a high risk for my next one?
So the most common reason for preterm premature rupture of membranes is infection. So progesterone could help it relax your uterus, or could help to relax your uterus, so that if your uterus is crampy and it's rupturing because of that, but otherwise no, and it certainly wouldn't help in an infectious state. So those are the cases where we actually like doing fertility, because we figure out what's wrong and then we treat it, and then you don't have the problem anymore. I can tell you, I've had loads of patients who have had second trimester miscarriages. They've had, premature rupture of membranes. We test their fertility, we find out what's there, we fix it, and then they don't have that problem anymore. One of my favorite patients ever, love her to bits, super sweet lady, had a loss at a very, very, very bad time, immediately before the baby was viable. And we did the fertility. There was a whole bunch of bacteria in there. I treated her, and we kept her pregnant till I think 36 weeks. And then she went into labor and had her happy, healthy baby, and now has a beautiful family. So it's a real easy way to fix problems like that. And again, I don't have any financial arrangement with fertility. I love them. They're good people. They're very nice. But not supporting Fertility. Any company that could do that same test well, like Fertility does, I would say the same thing about. And in fact, we may start doing it here once we get our PGT machine. I didn't tell you we bought the PGT
You
set.
did, eh?
Yeah, yeah, we got an amazing deal. So we will be able to do the Fertility test here, which
Super
is
cool.
cool. Yeah.
Hi, Dr. V. What's the difference between a SIS and HSG? If the SIS is abnormal, then you do a hysteroscopy, or can you do both SIS and hysteroscopy?
So a saline infusion sonohystogram, SIS, is an ultrasound where we very gently flush fluid into the uterus, and you're able to assess the cervix, the uterus, the inside of the uterus, the outside of the uterus, the fallopian tubes, and the ovaries. So you're getting a full assessment of everything. You're looking at follicle count, you're looking at ovarian cysts. You can tell if the uterus is normal on the inside, so it has a normal uterine shape, or if it's septate. You can tell if it's bicornuate, didelphic, whatever abnormality there is. You can determine all of that. And we even comment on, was the cervix tight? If they've had a previous cesarean section, you can tell if they've got a isthmocele, where you have the C-section scar defect. With regards to a hysterosalpingogram, a hysterosalpingogram is an X-ray test where you're flushing dye through the cervix up into the uterus and through the fallopian tubes. It only tells you if the tubes are open and if the uterus from the inside has a normal shape. It doesn't even really tell you if the cervix is open or closed, because it's this great big huge kind of apparatus that we use to do it, and it's not finessed enough to tell you if the cervix is tight or not. It's kind of a bruiser of a device. So in those circumstances, you have way less information, and it's much more painful to have a hysterosalpingogram than it is to have an SIS. With regards to hysteroscopy, I am shocked by how many people in the US go directly to hysteroscopy or do an ultrasound and go to hysteroscopy. It's wildly unnecessary. You can do a saline infusion sonohystogram, get all the information you need, and it should be way cheaper and certainly much safer than doing a hysteroscopy. Hysteroscopy is by and large only if you see some sort of pathology or abnormality on the saline infusion sonohystogram. So, for example, you've got a polyp, you got a fibroid, great. You've got an abnormal shaped uterus, there's a septum, it's T-shaped, whatever. Yes, we do hysteroscopy all the time. But aside from that, there's no indication to do a hysteroscopy unless you either can't do the saline infusion sonohystogram or you've seen something on the SIS that suggests that a hysteroscopy can be therapeutic. But diagnostic hysteroscopy, pop a camera in there to look around for what? Like, there's literally almost no indication to do that.
Do you perform a C-section yourself on your patients or no?
Yes, all the time. I did one last night at, what time did I start that? 7:30 at night. It was late, but yeah, I do it all the time.
How many rounds of letrozole does it take to actually get pregnant typically?
Well, that's a crystal ball question. So it depends on your circumstances. What's the sperm quality? What's your age? What's the diagnosis? Is it just PCOS? Is obesity a factor? Are either of you smoking, drinking, using drugs? So I can't answer questions about success. I can tell you from the LEGRO study, LEGRO, which was part of the Reproductive Medicine Network, that they did a study that was published in the New England Journal many, many years ago now. I want to say 2006, but don't quote me on that part, where they demonstrated that letrozole was better than Clomid. And in 6 cycles of letrozole, they had a 27.5% live birth rate. With Clomid in the same 6 cycles, it was 19.1%. So, in theory, 6 cycles of letrozole should give you roughly a 1/3 chance, or between a quarter to a third of a chance, that you will end up walking away with a baby.
Does PIO injections have to be at the same time every day?
No, not at all. People get so nervous about timing everything exactly right. You have to understand how pharmacodynamics works. So you take your drug and the level rises and goes up like a bell curve, a ski hill, right? Goes up. And then, it stays plateaued for a little bit, depending on the half-life of the drug. And then it starts to dwindle down as the half-life of the drug wears off. And then you take another dose and it goes up and down. So you're doing this all the time. The key is that the therapeutic level of the drug is somewhere roughly in the middle. So you start low, you go up, you overshoot, you come down, you go up, you come down. But you're keeping enough drug throughout the process to keep a reasonable degree of therapeutic efficacy the whole time. The thing with progesterone is we're giving you so much, you're up high always. So there's never a time where you're going to drop down unless you abandon it completely. So the timing is not important for any of the stuff that we use to that extent. Sure, a little bit. Like, I don't want you taking your, cetrotide at 1 in the morning instead of at 6 in the evening, because you could let the eggs release if you missed it by that much. But by and large, if you're off by an hour or even two, nothing is going to happen to your fertility cycle.
I just found out I'm pregnant.
Congrats.
According to the last period, 8 weeks and 4 days.
Excellent.
Didn't contact the doctor yet.
Okay.
Not sure what my next steps should be.
Usually we would start with a beta HCG to confirm that it's rising appropriately. And if you're 8 weeks, you could go straight to a dating ultrasound to make sure that your pregnancy is viable. How many, gestations are there? Is it in the right location? Although at 8 weeks, if you're not having pain, you're probably fine. And then make arrangements to do your EFTS, which is your early first trimester screening, or NIPT if you choose to go down that path. So start with a beta and your basic blood work, and then ask them to arrange a dating scan for you. If you're with us, just call the office and let us know. We take care of all of that for you.
Hi, I did an IUI today. Is 14 million post-wash good? Is it okay if I only had one mature follicle? Is it true the more you do it, the better the chances are?
So in terms of one mature follicle, that's fine. In terms of 14 million, that's the threshold for being a reasonable IUI, depending on which study you read. There's two really big studies. One said 9 million, one said 14 million. So with 14, you're safe either way. And then in terms of the more you do it, if you're referring to sex, yes, that's true. If you're referring to IUI, no. Beyond 6 cycles of IUI under the age of 38, your chances of success are essentially 0. And over 38, it's 3, and the chances drop off dramatically. So we don't tend to go past those numbers because of the study that showed that. I'll make some rare exceptions, but generally those are the numbers we stick with. You're deep in thought.
I just wanted to see how far behind we are.
Lots of people.
It's a good one. Okay. I just want to make sure I didn't skip anybody. Somehow that's a comment.
That you missed their question.
Yeah, they don't realize that there's a billion of them, but it's okay. Anyway, one comment is, I believe in you, Mr. T. I appreciate everyone believing in me. What's the percentage of IUI success with gonal F trigger shot progesterone unexplained infertility over 40 m washed sperm?
Oh wow. Over 40 million washed sperm. Depends on your age, but I would say probably somewhere on the order of around 15%, maybe 20.
There's a question I have never read before.
Okay.
The phrase.
All right.
How common is vanishing twin syndrome in pregnancy with letrozole? And are there any added vitamins you would recommend to help boost energy in twin pregnancies?
So vanishing twin syndrome is fairly common. I don't know that I actually have a percentage for you. I could probably look that up quickly, but I don't know the exact number, but it is very, very common. As far as vitamins to boost your energy level, vitamin C, vitamin D will help quite a bit. Iron, make sure you get your thyroid checked. So those would be the main ones that will help you. Vanishing twin syndrome. Let's see if we can get this individual a number.
How about a little explanation for those that have never heard of the term?
So it's when you start with twins, but one of them doesn't make it and it disappears. So it's called vanishing twins.
It disappears.
Like it literally just dissolves.
Really?
Yeah.
Interesting.
Yeah. And it's not good because it actually increases the risks of the pregnancy.
I would imagine.
Yeah. Let's see how often it happens. I love having this here. It's kind of convenient, you know. You look it up, and
For sure.
although I have to say, my little Persian rug mouse
It's not doing it, eh?
carpet thing, yeah, that isn't working at all.
Is it too small? Is that the problem?
No, it's like gritty against the bottom of this. It is estimated that, wow. It is estimated that vanishing twin syndrome occurs in 36% of pregnancies with 2 sacs, 53% of 3 sacs, and 65% of 4 or more sacs. With regards to IVF ICSI pregnancies, 2 studies published in 2005 and 6 estimated that somewhere between 12 to 30% of twin pregnancies in weeks 7 to 8 reduce them to singleton. That seems really high. I mean, we're not seeing that clinically, not even close. I would have thought it would have been 1/10 that number, but I'm reading this from a recent 2020 review article. So they must have studied everybody else's stuff. Interesting.
Interesting.
I like it when the viewers make us like have to work at it.
To research
I
it.
like getting challenged because if I don't know it, it pisses me off, and B, I like to look it up. So
Perhaps an easier question for you, Dr. Victory.
okay.
I found out
Yeah.
that my baby is breached at 36 weeks.
Oh, good. Okay.
Is there a
Cool.
reason for babies not to turn?
Yep. So funny shape to your uterus would be number 1. So if the uterus is septate or bicornuate. Number 2 would be some kind of obstruction. So whether your pelvis is too small or your baby's head is too big, or let's say you have a huge fibroid or something in the way, then the rest of it's just bad luck. We often joke around in the OR and say they have to be boys because they're bad with directions. So you have some options as to what to do. Option number 1 is to try and do what's called an external cephalic version. So we give you an epidural, we relax your uterus, we push the baby's bum up, and then we rotate it around. I'm actually quite good at doing that, so I have a relatively high success rate. And it's generally speaking safe, but you do have to be careful about picking the patients appropriately. Reasonable amount of fluid, not a huge baby, a reasonable sized mom, and placenta preferably in the back, not in the front. So all of those work in your favor. And then if you don't want to do that, you can try deliver the baby breech. The problem with delivering breech babies is very few people remember how now because we haven't done it for a long time. And more importantly, there was a breech trial done way, way, way back in like 2001. And that trial showed that there was a 7-fold increase in the risk of adverse outcomes. And this was a worldwide study actually done by a midwife. So they stopped doing breech deliveries at that point, and they told everyone to do cesarean sections. And then lastly, you have the option of just going straight to a cesarean section where we just deliver the baby breech at the time of C-section. And I would say the overwhelming majority of moms choose that, but not everybody. And I do lots of external cephalic versions. So interesting that you asked that because I just offered that to one of my patients yesterday. Yeah. Yeah.
Hi, Dr. VNT. What do you think about Mosey Baby at Home IUI? Does letrozole improve egg quality while it increases egg maturation?
Letrozole does not improve egg quality whatsoever. Mosey Baby at Home IUI?
Mosiebaby. Mm-hmm.
MOI
Mosie baby.
Never heard of it before. Should we look it up?
Another challenge.
Another challenge. Mosey. Oh, Mosey Baby. Look at that. It came right up. Let's make a baby.
Here we go.
Is it me, or does the one hand there on the picture look like a kid's hand wrapped around the mother's belly?
I would say small.
Oh,
Yeah,
no, that's mom's hand. That's dad and mom together, or mom and mom, or whatever that's supposed to be. What is this?
let's make a baby.
How it works.
How it works.
Oh, with our friend Dr. Laura Shaheen. So
You do it at home?
it's a ICI.
Hmm.
Yeah, it's not going to work. This is basically doing intracervical insemination, unless I'm mistaken. And I don't believe that I am. And intracervical insemination is basically useless. So don't bother with that. That's not going to help anybody. Yeah. Sorry.
Interesting.
Yeah.
Now we know.
Yeah.
Hi, Dr. VNT. How successful is a mini IVF with Clomid? I've done 2 previous IVF cycles with unsuccessful. Last cycle in September already used more aggressive protocol. Only 1 tube and ovary.
I mean, Clomid's going to make you make 2 or 3 eggs. It does probably make a fresh transfer challenging. So you're most likely looking at frozen. And so if your ovary is only capable of making 2 or 3, why not use Clomid? It'll save you thousands in drug costs. But if your ovary is capable of making 10, why would you go for 2 or 3? We know that the more eggs you produce, the better your chances are. So with rare exception, more is better. Now, there are some people whose bodies react kind of badly to the drugs, and it hampers egg quality. And in those scenarios, you definitely are free to try something easy like Clomid. And again, I'm a big believer in individualization. I have seen women that don't respond well to the shots and respond great to Clomid. So you can certainly try it out. There's no harm in doing that.
Are estrogen patches better than oral estrogen for endo patients with Hashimoto's?
Well, I guess my question to you would be, if you have endo, why are you on any estrogen?
Great question.
You shouldn't be. So you should be on letrozole. And then if you are using estrogen, super, super low dose, the lowest dose patch is still too much. So that's why we use like half an estrase pill, or 1 milligram of estrase if we have to, and only if we have to.
How soon after stopping Depo-Lupron can I expect a CD1? Worrier about fertility testing, but still no cycle.
Generally speaking, around the month after you are, so like if 4 months after you took your initial Depo-Lupron shot, if you took a 3-month version. If you took just the 1-month version, like a month later, you should have one.
I know most RDs have patients stop progesterone at 12 weeks or so.
Yep.
Why do you continue your patients on it?
Yeah. Because progesterone is known to reduce preterm labor. And in our patient population, those being fertility patients, they're at higher risk for preterm labor. I actually have a ridiculously low rate of preterm labor. So it's undoubtedly because we keep all our patients on progesterone. And it just makes sense, right? You've got the population at risk. We know that their risk of preterm labor is higher. We know that progesterone prevents the preterm labor. Why wouldn't you give that population progesterone? It's super easy math.
Does low iron affect egg quality and implantation?
Um, Probably yes. I don't know that I've actually seen a study on it, because it's more in the naturopathy world, but we correct our patients' iron levels before we start anything, because if you get into a pregnancy with low iron levels, you're exhausted. And your baby will suck up all your iron. And then by the time you get to 28 weeks, you need iron infusions and you got to go to the hospital, and it's a pain in the butt. So, correcting iron ahead of time is important.
Is 8.5 million sperm post-wash good for an IUI? 21 mil per wash.
It's not ideal. As I mentioned earlier in the show, 9 million in one study was the minimum threshold for a reasonable degree of success. In another study, 14 million. So you're kind of borderline. Um, it's very close though. So I would still expect a reasonable degree of success.
If my microflora, according to Fertility, was good in August after the three-course round of antibiotics, should I still be okay when I start trying end of January,
Yeah,
or does this quote unquote go bad?
no, it should be fine. As long as you didn't contract something new in that time, you should be okay.
What is the best treatment for infertility related to stage 4 endometriosis?
Okay, so everybody's different. Um, I can't tell you what you should do. You need to talk to your reproductive endocrinologist. However, most fertility patients who have stage 4 endo are going to end up needing to do IVF. You're going to have to do IVF. Then you have to have a discussion of whether or not it's worth it to do surgery. And then I believe you need to follow our endo protocol. So we suppress our patients for 3 months, Lupron and Letrozole. We put them on tons of supplements and vitamins and so on. We then go on and we put them on letrozole protocol. We use little to no estrogen. We use high dose progesterone, double vaginal and injectable. And then we put them on an immune protocol as well. So that's what we do. It looks like our endo protocol has taken off because I'm getting calls left, right, and center for it. But yeah, that's what we do. So that's what I would recommend. Arguably, if your tubes are open despite your stage 4 endo, you could try IUI as well. That would be way easier. You don't need quite as much intervention, but your chances of success with stage 4 endo and IUI are likely quite low.
Is an HCG trigger shot while taking letrozole necessary when you ovulate on your own anyway?
No, not at all. Now, there are studies for and against it, and we followed those studies as a result of this show. So here's a great secret about our show. We learn stuff, we try it, and it doesn't always work. So then we go off of it sometimes, and we do tend to bring that to your attention. So we brought this topic up, boy, about 2 years ago. So 2 or 3 years ago, there was a study that said, it was the early days of the show, that said, don't trigger, because if you trigger, it actually decreases the success rate. So don't trigger people, let them release naturally. So we did. And then our IUI success rates tanked. And so then we went back to triggering and they came back to normal again. So now we trigger. So I don't know what the answer is, but we are currently triggering.
Hi, Dr. Vinti. If IUIs were unsuccessful prior to polyp removal, will it work after the polyp has been removed, and is a 2.5 centimeter polyp a significant size polyp?
2.5 centimeters is huge. We take out polyps when they're half of a centimeter. So 2.5 centimeters is enormous. Um, will it work after you remove it? I mean, I never would have started with it there. At least in our practice, we remove polyps before treatment because they decrease chances of success by 50% and increase miscarriage risk by 100%. So we're quite careful about that. I don't know that I would have proceeded anyways. But would I try again? Again, it depends on your age and how good the sperm is and what kind of protocol you're using and what else is going on in your body. But if it was just something really simple, sure, I see no reason why you couldn't try again.
Is it normal to have a chemical pregnancy where you don't start testing positive until after a 5-day heavy period? I've had at least three like this where my HSE rises after bleeding and then takes a while.
No, I would definitely want to see you and figure that out. That sounds either infectious or structural, like polyp fibroid adenomyosis. That seems like something where we would definitely need to check it out.
Did you mention in one of your lives that Viagra vaginal suppositories can help with NK cells?
Yep, that's well established.
What are your thoughts on failing the 1 hour gestational diabetes test by point 0.1?
My thoughts are you need the 2 hour test to verify whether or not you do or do not have gestational diabetes. That sucks. And I feel bad because that no woman likes drinking that horrible syrupy drink. And I feel for you, but necessary evil to confirm that everything is out of your system.
So what finally worked for me after two chemicals was 3 DPO progesterone and baby aspirin and melatonin. Thanks to you. What does
Oh,
that
I
tell
love
you
those ones.
about what my issues may have been? Immune?
Immune supplements. Yeah, low progesterone level. God, I love it when you guys give us those stories. That's so cool. Tell us where you're from. It's particularly fun when you're from like Korea or something like that. Yeah. I wonder if our Korean friend is back. Say hello from Korea if you're back on from Korea.
Whoever thinks they're the farthest
Let
should
us know.
say,
Yeah, we should do that.
yeah,
That should
yeah,
be a
yeah,
good contest. Yeah.
yeah. Is caffeine daily, like an energy drink, cause an issue for men and or women when trying to conceive?
One caffeinated beverage per day for a woman is fine. Beyond that, it has been associated with miscarriage. There's a Lancet article from years ago that looked at that, a meta-analysis of caffeine intake in relation to miscarriage risk. So we tell women not to have more than one. For a guy, 2 or 3 is reasonable for sperm. However, if you're talking an energy drink like a Monster or a Red Bull, you may as well just open up your mouth and pour in gasoline. It's pure poison. That stuff is toxic as hell. So don't be drinking that. That's horrible for you.
Can we take CoQ10 while breastfeeding?
Yes.
How long after all testing with you do we find out our results and start treatments usually?
Um, Typically like a month or 2 after, but I don't want to commit to anything because if I do and I get it wrong, Mara will kill me. So it could be longer, but generally speaking, a month or 2 later, we get you in.
Is spotting 2 days before a period starts a symptom of endometritis?
It could be. It could be a polyp. It could be a fibroid. It could be adenomyosis. Could be a uterine septum. Could just be bad luck. It could be hormonal. So hard to know. But it could be from endometritis. It's possible. But we, generally speaking, in the grand scheme of things, endometritis has no symptoms.
Are Omnitrope and Suzanne the same? Can it make a difference which one you prime with?
They're the same, and it makes no difference, at least in our experience. Although I think Omnitrope is cheaper, but it doesn't make any difference.
What is the recommended dosage for curcumin
Curcumin,
and
60
resveratrol?
milligrams, 60 milligrams and 1500.
Do you have a sister clinic in Toronto?
Oh, I have like a second cousin twice removed clinic in Toronto. Not quite a sister clinic. But we do work with clinics in Toronto that will monitor for us, screen for us, provide therapy for us. So if you need that done, let me know. And actually, oh, I didn't tell you this. Very famous doctor in Toronto, huge, reached out to me and asked if I would provide care for some of their patients. I won't say who for obvious reasons, because we provide a specific service here that they don't. So I thought that was kind of
Wow.
cool. Yeah.
Cool.
Yeah.
Very cool.
Yeah. I was excited about that. So yeah, nice.
Very
Nice.
nice.
Word is out.
Word is out.
Word is out.
Yeah. Habibi, how are you? Oh my God, I miss your lives.
Soraya. Hi, Soraya. I hope you're doing well. Hello, Habibi.
How much of an influence would having allergies, asthma, and eczema have on infertility with suspected endo?
Oh,
How could this be managed?
yeah. So most of the time, you'd find there is some degree of immunological resistance, and those are patients where we would advocate for testing and treatment and so on. So yeah, that could be very significant. So I would want to definitely either provide you with an immune protocol or test you and then provide you with an immune protocol, which is always better.
Any clinics in any clinics you recommend in Canada?
Well, ours. um, Without getting into too many details, someone very near and dear to me recently went through fertility preservation treatment and did not have a good experience. So that was problematic for sure. And I was quite shocked because I had recommended the facility that this individual went to, and this individual was not pleased with the care that they received. Um, I know of one other clinic that I really trust, and I know of several doctors that I really trust, but Yeah, I mean, reach out to me, and if you need to be somewhere else, I'm happy to provide you with names and stuff. It would all obviously be kind of self-defeating to recommend those to everybody when we have our own clinic here. But if you desperately don't want to leave wherever you are, reach out to me and I'll privately give you my opinion on what I think of other clinics. Not something I'm going to broadcast here. We're very careful to never smear anyone specific or mention names or anything like that. Listen, I'm sure there are fertility specialists out there that disagree with me. Recently, one told one of my clients that if they wanted to work with them, they couldn't have a protocol that was on YouTube like Dr. Victory. They had to have a protocol that was real. Apparently, my protocols aren't real. I don't want to smear anyone. There are people that disagree with what we say. Clearly, I disagree with what a lot of other physicians do. So, let's keep it professional and friendly. They can do them, and I'll do me. But if you want recommendations, I'm certainly happy to give you recommendations. Um, Very easy recommendation for me to make. If you're in the Toronto area, our sister clinic or second cousin twice removed clinic is Tripod with doctors Zaneku and Romain. Great people, just fantastic people. And there are others, so I don't want to say they're the only ones. There are many others, but these are very, very good people who genuinely care and do a great job. So, if you're looking for someone there, you can work with them.
What are your thoughts on berberine?
Berberine. So berberine has some anti-inflammatory properties, and it's been studied in relation to endo and showed a real maybe improvement in outcomes and pain. So it's certainly reasonable. We already have our patients on a 5 supplement endo protocol. You can overdo it with supplements. In fact, I told a couple the other day she was on too many. And when you're on too many, you can end up with something called reductive damage. And that's not good. So, yeah, we try and be very cautious about that kind of thing. But it is usable. We're past 9.
Yeah,
That hour flew by.
flu.
Flew. Tarek's terminal question.
Oh, wow.
I got OR tomorrow.
Okay.
I can't believe you just did.
It actually worked too. Like it actually, there's that many questions below that it's an endless scroll.
We will get to your questions. Tarek will screenshot a bunch of stuff and send it to me. I will start answering your questions.
Well, this is a great comment.
Over the holidays too. I answered a bunch of people's questions the other day while I was on the call. Yeah.
Tuesday nights are my favorite because I love this show so much.
Oh, that's very sweet. Thank you. I love the show too. Yeah, in large part because I love Tarek. Strictly platonic, but I do love the guy. So we hadn't seen each other last week, so we were very happy to see each other this week.
Oh, that's great.
Yeah.
Okay, one last question, right?
And he ordered a Cybertruck, which is super cool.
Well, we'll see about that. Announce it to the world.
Now, are you going to give away your car? Like, or not give away, but are you going to return your car if you get a Cybertruck?
Oh yeah, for sure.
You would.
Yeah. I think it's about 2.9 seconds. 2.6, 2.5. 2.5. 0 to 16, 2.5.
The comparison where it's racing the Porsche and then at the very end you realize it's pulling a Porsche and it still wins. That was the best ad ever. Like, just advertising.
So my kids thought I should get the car for one main reason. There's only one reason they're convinced that I should get it.
Yeah.
It's because it's bulletproof.
Yeah, I heard that it is bulletproof.
For them, they thought this was of a major concern.
Well,
as to what they think I do for a living, if I need a bulletproof vehicle, I don't know. Well, but they thought that's a very strong car.
Considering there are some hostile REIs out there towards me.
Yeah. Indirectly, they're coming after me.
You and I may need a bulletproof
They want my blood. Yeah. I don't know. There's so many. Like a terminal question. I feel the pressure that I can't just ask anything.
Just ask anything.
Okay, I'll ask anything.
All right.
It's got to be at least a little bit better.
Anything, but not quite anything. Is that what you're doing?
Well, yeah, I don't want
Okay,
one. I don't want one that I can answer.
I gotta tell you, this tea is phenomenal.
You know what? I'm betting money. Warm
It's the-
tea is better than cold tea.
It's really good. It's really like
It's very soothing. I'll
it's
give you a
very
soothing.
soothing. It's really creamy. I hope I sleep like a baby after.
Oh, here we go.
For all 3 hours that I normally
One of the
sleep.
reasons why I'm going to answer this question, just for everyone to know, is because it does make mention to me. So that is part of the selection process.
You are the most openly like, obvious somebody loved me puppy I've ever seen in my life.
Well, because the fear, of course, is that they think that there's another reason why I ignored them. It's not valid that there's 100 questions.
It's purely based on likes. The more likes you hit into the thing, the more he's likely to choose you. Yeah. And again, I have no idea who you are. I don't know who the people asking the questions are. I don't know how many likes you're giving me. I'm very neutral. I am Switzerland, okay? He is not Switzerland.
I am very biased.
Yeah, he is very biased.
I am very biased.
You're Iran, man.
Yeah, I want a great intro. Hi, Dr. V, and super amazing, fantastic tea.
With lots of likes.
Yeah, with hearts and everything. These are my type of questions.
Yeah.
Okay.
We should make people bring us 10 followers, subscribers, whatever.
Oh yeah, sure.
And then we'll
that's good.
That's
a good one.
Yeah.
That's a good one. I scrolled away. Here it is. Hi, Dr. V and T. If you had endometriosis, which dose of testosterone gel priming do you recommend?
Excuse me. It's always 12.5. I'm going to die now. 12.5 milligrams. That was too easy.
That was too. I feel ripped off.
I feel ripped off. On
Okay, let me get you one more.
Okay.
Okay. Your daughter had joined, but she didn't ask a question that I could see. So just mental note of that.
Oh, okay. Hi, Jay. I hope you're well, honey. I love you.
Okay. Hi, Dr. V&T. If IUIs were unsuccessful prior to polyp removal, we did this 2.5% of your question.
Yeah, you did that one.
She asked it over here as well. That's why. Hi. I finally made it to the live. Is this an Ask Dr. V anything or a specific topic for questions?
No, Ask Dr. V anything. Although it's on the tail end. You're asking all the wrong questions.
I'm noticing. Okay, here we go. What are your thoughts on pre-seed?
Oh, pre-seed's great. So pre-seed's one of the few lubricants that actually has proven benefits. So you can use pre-seed. You don't have to use pre-seed, but pre-seed is a pretty safe lubricant if you're trying to conceive. It's stupidly expensive, but it does work. I think we got to wrap it up.
Wrap it up.
Have a great night, everybody. Are we doing a show? What date is it?
So somebody's asking you about your Christmas schedule, quote unquote.
Oh yeah.
In terms of the shows.
So next week will be the 19th. We can still do the 19th,
yeah.
right?
Yeah.
We'll do the 19th. And then the week after would be the 26th, which is Boxing Night. I don't think anybody.
I'm here. I'm not here.
You're not here.
I'm gone for the first week.
Where are you going?
I don't know. It was your advice. I'm going to Kalahari.
Oh, you're going to Kalahari?
Yeah.
Over Christmas.
Over Christmas.
Oh, dude, that'll be fun. Okay. So,
never been. It's all your recommendation, just so you know. And I dragged my siblings with me as well.
And then we'll be back when
I'm just gone for a couple of days after that.
No, but what's the calendar?
That's the New Year's New Year's Eve is the 2nd.
New Year.
Sorry, but that make any sense.
No sense whatsoever, dude.
Let me get
so
for the holidays.
Tuesday the 2nd, we're back.
Yeah, I'm back as well.
And I don't think I'm on call, but I'll have to double check.
You gonna be here?
I doubt I'm on call. Yeah, I'm coming back from the cottage that night.
The night of the 2nd?
No, actually, I have to be working on the 2nd. So I'll be here. I'll be here.
We'll be here.
Be back on the 2nd.
I can be here.
So we'll be here next week. We're going to skip Boxing Day.
Yeah.
And then we'll be back on the 2nd.
Okay.
You're good with that?
Schedule has been made, ladies and gentlemen.
Have a good night, guys. Thank you very much for watching another entertaining episode of Fertility Fact or Fiction. Hope it was a great show. Hope you enjoyed it. If we didn't get to your questions, I promise you we will do our best to try. But there are only so many hours in a day. Also, look for exciting new VRC clinics that are opening very, very soon. I'm signing a lease tonight. We have the other one already ready to go. So we'll be up and running in the community near you. See you soon. Take care. Excuse me. Should I